Okay, I want to welcome everyone who's joining us today, and we're ready to get started. As you have questions, you could type them in, and I'd be happy to post them to our guest. So I'll read a little bit about this webinar and then introduce our guest speaker. Often, when we hear about the healthcare industry, we're inundated with large numbers and nationwide trends. It's important information, but we lose the human aspect of healthcare, how individuals handle an often overwhelming system. Too often, patients don't know where to start, and this unfamiliarity leads to delaying preventative care, pointless testing, and unnecessarily high medical bills. Sana Goldberg's new book, and Sana, you could hold it up if you'd like, How to Be a Patient, The Essential Guide to Navigating the World of Modern Medicine, aims to combat this uncertainty of providing a guidebook for patients to prepare them for any and all potential medical events. How to Be a Patient breaks down the complicated and sometimes uncertain medical landscape with information and tools, some of which we'll address today. Sana Goldberg is a nurse, author, and public health advocate. A graduate of Reed College, she studied neuroscience and eventually decided to become a nurse. She's worked with cancer patients, surgical patients, and geriatric, refugees, and LGBTQ populations across various settings, specializing in dual diagnosis in women's health. For 2016 TEDx Harvard talk, What If You Become a Nurse?, aims to draw people to the profession and explore the public's relationship to nurses. She is also the founder of Nightingale Magazine. Sana, welcome. I'm so glad you're here. These are such important topics. So thank you for writing this book, this incredible book, and thank you for being here today. So I wanted to start out by talking about, is there a formula that patients should follow when trying to decide on the best healthcare provider?
So my answer to that is that it's always about how you communicate with somebody. And I think, a good fit especially with a primary care provider, because that's usually what we're talking about in this setting. It's different for everybody, but you really want somebody that when you're talking with them, it invites ease and trust in the conversation. And I always tell patients, if you feel belittled by somebody or spoken down to, it's kind of a recipe for not the best care when you're in the world of medicine today. So I think really paying attention to how you communicate with somebody is essential.
Is there a way to sort of interview a doctor when finding a doctor? Because that relationship is so important. I've heard people who won't move because they have their roster of doctors set up and they don't want to change and start with a new doctor. So those relationships could be really long-term and really vital. How do you, and I know some people are afraid to, they think they're afraid to speak up to a doctor, to question a doctor. But my main question to begin with is there an interview process? Could you make a call on Jones?
So a lot of private practices especially will offer something like a meet and greet where you can have, and it's usually just a handful of minutes you can get with somebody, which is never enough, but it does help to sit down with somebody and, see if you think the communication style is a fit. And, in those circumstances, I tell people to kind of think of these medical situations you found yourself in out in the real world where you needed the help of a primary care provider and maybe didn't have one or had one that you couldn't get to. Like, think of those real situations. So maybe you needed a prescription refilled but weren't able to get in for an appointment, or you were traveling and had some kind of medical situation come up. And so ask about those things. Think of those situations you've been in and bring them up. And it's kind of a good litmus test for how if a person's going to be as accessible as you need them to be.
That's a great point. That's a great point. And that ties into time management, I guess, preparing ahead, right? Having a list of questions ahead of time. What is the best way to maximize your time with the doctor?
I would say it's by asking questions, which kind of, runs counter to what you would think. But the research really shows that the more questions patients ask during an appointment, it really does have a positive outcome on how they'll manage their disease out in the world and manage their health out in the world. And for this book, it was very interesting. I actually was able to look at a lot of linguistic studies that just looked, how patients would communicate with a provider, and really asking questions up front and early on and kind of maximizing those during appointments really is such a powerful tool to navigate your healthcare.
And how do you see the most effective doctor-patient relationship? So how do people take more control to maximize that relationship? Do you see it as, overall, we are in charge of our everyday lives. We are in charge of administering our own medicine and carrying out what the doctor recommends. But it's important that we're informed as well, and we're an active player. So how do you see an ideal doctor-patient relationship? What part is on the control? What part is what's a patient's role and what's the doctor's role as you see it?
Well, one of the things that they tell you a lot in nursing school is that while medicine tends to focus on a disease, nursing is kind of more, nursing tends to look at a person with a disease in the context of a lived life. And so I think, my training, because of my training, I tend to think that way. And in this book, I tell patients, one thing that you can do that's really powerful is to convey that context, because, a provider, especially when they have a limited amount of time, they can't, they're going to need you to kind of come to the table explaining how a disease impacts your life, maybe give them information about, your background, your occupation, things that you might not necessarily feel are relevant to your healthcare, but to kind of give somebody a picture of your day-to-day and how your health, especially if you're dealing with a condition, how it impacts your quality of life. That's really important. So I think, knowing that that a provider is going to be an expert in medicine, but you're the expert on your body, you're the expert on your life, and how your health impacts your day-to-day. And so you really kind of need to bring that context, because I tell patients it's like you can't be treated in a petri dish. What's the right intervention for you might not be the right intervention for somebody else, but it really depends on conveying that context and kind of showing up and knowing that you have to bring that to the table.
So are you saying, like, paint an accurate picture, paint a clear picture of how the illness may be impacting your life and what could be done?
Yeah, absolutely. I was talking with a patient this morning, actually, who struggles with diabetes. And, one thing that will happen is, a certain patient may be willing to make, let's say, a lifestyle intervention, like change their diet or change their activity. Whereas another patient might just upfront say, that's not something I'm able or willing to do. This is something I can do financially or, realistically, or this isn't. And so those are things to think about too, because what's sort of a general intervention might not factor in something you're able to do, and also, patients might stay quiet if there's something that they know they're not going to do. Sometimes patients will come in and they'll say, oh, nothing's changed, but then you realize they haven't been taking the medication or they weren't, doing the kind of protocol. And I think it's really fair to say, if it's not something you're able to do, to discuss what other options there are for you.
That's great. How do you advocate for yourself? So if you are not necessarily in total agreement with your doctor, how do you stand up for yourself, whether it's a doctor's approach or whether it's a doctor's advice? So I'll give you an example. I had a doctor who, no matter how I was doing, he always pointed out the negative, the what ifs. And I would leave his office really upset every time. Even if my blood work results came back good, or the test came out positive, in a favorable way, he always kind of pointed out what could happen. Mm-hmm. So I had to sit him down and have a talk that just doesn't work for me. I understand you have to know the negative, and you have to be aware of the what ifs, but I'd like some positive too, so I don't even always leave the office crying. So what do you recommend as far as advocating for yourself or speaking up? And I think so many people are intimidated, afraid to speak up. Is it appropriate to speak up, and how do you advocate for yourself?
Yeah, it's always appropriate to speak up. I'm glad you did it. It sounds like that's like the perfect thing, I would say, because especially if you have time and a history invested with somebody, and like you're at a level where you've built this rapport, you don't want to just start over with a new provider. I think that to be invested enough to like bring that to the table and say, this is not, this isn't working for me, this is making me anxious, this is like causing me more stress than is necessary. And I think a lot of times it's just saying that in a way that's assertive, but respectful, but still assertive, and getting your point across should be welcomed in a medical encounter. And I think if it's not, and if there's no room or time for that, then it's probably a sign that overall it's not a good fit, because those are really valid concerns. And so a lot of this book is really trying to empower patients and remind patients of things like the fact that you're a consumer. There's certainly a lot at stake when it comes to your health, but you also really are in the driving seat. But I think we have such a powerful, the way we register somebody in a white coat, and this like extends back to research from like the Milgram experiment, so decades ago, but it is very powerful. And suddenly we kind of take a back seat and we defer and we're very passive. And so it's just sort of, I really talk to patients about unlearning that kind of subservience, because you're working with somebody, it's like a team, it's shared decision making. It's that power differential is like really never going to factor into your care in a positive way if you're afraid to speak up.
Mm-hmm. Personally, I have lupus, and I've had 2 kidney transplants and lymphoma. So I've battled like lifelong illness. Mm-hmm. And I don't have a medical degree, but I know how to interpret my blood work results. I know when something doesn't feel right. I know when I should question something. But this is something that has never been taught or really addressed. And that's why I think this book is so vital, because I never asked someone, what are the expectations? And things like, there are doctors I really love who I believe have been a main reason I'm still here today. And I hug them when I'm done. Mm-hmm. Is that totally inappropriate to say, I need to hug you? Like, you just have played such a role in my life. There's doctors I really love. And I always think, is that inappropriate that I'm giving them a hug?
No, not at all. I mean, that's my take on it. Anyways, I did another interview this morning, and the woman who called in had the same sentiment. Just like she had these incredible providers that kind of stepped in at a really critical moment. And like I said, when you find those people, first of all, if they're in like a primary care setting, just like grab onto them and don't let go, because you're so lucky when you find somebody good. And you feel it. It's like a very rare gift, and it's So I think that, and also being on the other end of healthcare delivery, I think because everything is so fast paced, there aren't a lot of these like organic moments for just human connection. But like that's why we're in it. That's why anybody is in medicine, I think, at the end of the day. So I think that's like very human and a welcome thing to do.
To that regard, on the positive side, when you do find someone and you hold on to them and you have this long-term relationship, what else could you do to let your doctor know? Like, do you give a good reference, or what's a good way to thank a doctor or to recognize a doctor? Is there anything else that comes to mind, or not? or not
I'm
really?
just telling them. I mean, I don't know if like that's ever a thing you've experienced, but just relaying anytime you get positive, you have a really positive care experience, to tell somebody, you know, what, like why it was positive, what mattered to you, and to be specific about it. I think anytime you're giving somebody you know, feedback like that, it's just nice to relay. So so yeah, I would say that. And then, you know, if you find somebody really good, and this is, I think, part of empowering people to really seek out a provider that's a good match. And one of the things I say in the book is, rather than kind of going through these insurance portals where you're populating different providers based on what's in network, what I really think is, you know, maybe runs counter to what we've learned, but is a more effective way to do it, is to talk with friends and family and other providers, like your dentist or, you know, whomever, to get a referral for somebody. And I think is, you know, going to the community and kind of spreading word that way about great providers is something I advocate for. So I think definitely referring people and saying, you know, I'm gonna refer you to, you know, X, Y, and Z person, it's a great compliment.
That's great. How accessible should we expect our doctors to be? So when, you know, emergencies arise, I have doctors who give me their personal cells, and I have people who, whenever you call, if they're closed, it says just go to an emergency room. So is there a norm in that, and what should the expectation be for accessibility?
So there's not a norm. It runs really along a gradient. And so I would say, back to what we talked about earlier, kind of think about that accessibility when you're interviewing somebody, because for some people, you might really need more accessibility. For somebody who manages multiple chronic illnesses, you know, you're looking at kind of a different situation than somebody who's, you know, maybe has kind of a clean bill of health and is just going in for a routine primary care appointment annually. And so I would say, you know, definitely ask those questions up front. And then another thing to consider, and you know, this model is evolving over time, but there are different settings for primary care. And, you know, now there are options like direct primary care and concierge medicine, which, you know, because they're new, they're financially inaccessible to many people, but, you know, with kind of what you pay out of pocket for healthcare expenses and what you're paying with premiums anyways, I think it is an option to look at for people who find themselves frequently interfacing with the medical model, to kind of consider some of these other potential primary care settings wherein, you know, they're built around you having more access to a primary care provider. And so they're not a go-to solution for everybody, but I think in certain circumstances, especially when you're dealing with a chronic illness, those options are worth exploring, because for some people, they really, the financial difference can be kind of even negligible to what they were paying for a more standard practice setting.
Does insurance cover that, or no, the concierge service? And do you, or no?
So concierge, this would be like a model wherein there's like a monthly payment to a practice, and many of these are just done outside of insurance. Some of them are billed additionally with somebody having, you know, sort of more broad coverage, but some of these models really just sidestep the insurance piece, and so it's either a monthly payment or a direct kind of payment for services rendered. So the models all vary, and, you know, I won't get into them all, but
there's no blanket rule.
What?
There's no blanket rule.
No blanket rule, but there are options, and they're kind of expanding. So looking into them and then sorting out, you know, financially what the differences are than just a general kind of PPO or HMO, that would be worth looking at.
And nowadays there's also telehealth, like our hospital offers this. You could log on and talk to a doctor in the case of emergency. And then there's so many of these 1-minute clinics, you know, popping up. So in an emergency, the ER versus urgent care versus an appointment, is there something you would say about that, the differences? And when it's an emergency, what you feel is the best thing to do.
Yeah, that's such a hard one for patients. And when I started writing this book, I knew that was going to have to be a topic, because even as a nurse, I feel like I'm fielding calls or texts like pretty consistently from friends who are like, look at this, this burn or this rash or this, fever, temperature. Do I need to go to the emergency room? What should I do? And I think people, especially because presently so few millennials have a primary care provider, like under half of millennials today have a primary care provider. I think it's just under a third of adults in the US have a primary care provider. So what happens is that people don't really have care established. And when something comes up, anything that that becomes intolerable at home, the options are the emergency room or urgent care. And we see in the medical system a lot of people defaulting to the emergency room, which makes sense because an emergency room is a place that you can go and get help if something's wrong. But the kind of downside to that is that if you go to the emergency room for something that doesn't really warrant emergency care, you can leave with just an astronomical bill. I mean, that far exceeds even your monthly income. And those are real situations people will find themselves in, where they go on a weekend maybe because they didn't know where else to go, and then they're set with this huge bill of services rendered at it. And the cost of services are much higher. They're exponentially higher in an emergency setting than they would be in, just a normal medical context. And so that's one factor, is that you will pay a lot more if you go to the emergency room. Also, if your situation isn't emergent in nature, you're going to be triaged. And so these are the stories where you're kind of like sitting and waiting hours and hours and hours to be seen for something.
Yeah.
So I always advise, really think about it before you go to an emergency room. The book is filled with, situations and examples of, when you're at this point, how do you kind of decide, like at this fork in the road, where to go? But I think, knowing that urgent care is often, for any situation that's maybe not imminently life-threatening, or that you worry could be life-threatening, but it's just too uncomfortable to wait with until Monday to call your primary care provider. Or if you don't have a primary care provider, urgent care can be a better and more economical option. But that being said, if you're ever worried that something is compromised, like that feels really like an emergency situation to you, I do not think twice about going to the emergency room. And there's been a lot with insurance companies even coming out saying, if you go to an emergency department and it's not an emergency, we're going to bill you for it. We're not going to pay for it. There's been just upheaval in the recent news cycle with that. And as providers, we get really upset, because if you're a patient and you think something is really wrong, you need to go in and get help for it. So it's like striking this balance between like trusting yourself and having that kind of gut instinct, but also knowing that there are options to you outside of the emergency room. For things that are just health problems that come up if you don't have care established anywhere.
Right. Okay. That's important to know. Can you talk, this is a totally different topic, but second opinions. So what do you have to say about that? And also, sometimes I feel hesitant to tell a doctor I want to get a second opinion. I don't want a doctor to think I'm undermining his knowledge or her knowledge. I've had doctors say openly, you're welcome to get a second opinion. It won't, please feel free. Do you have anything to say about patients getting second opinions?
Yes, I do. And I talk about it in here because you are not alone in that sense, that you're going to offend a provider if you ask for one. A lot of patients feel that way, and so they refrain from asking for a second opinion. And what I always tell people is that when you work in medicine, whether you're a doctor or a nurse, it's standard of practice. So for instance, if I was the patient, and when I have been the patient, I'll ask for a second opinion. I know doctors who would say the same thing. If it's one of their loved ones, they're going to ask for it. It's just standard of practice to get a second opinion, because the research shows that, much of the time you're going to get a different outcome, a different result if you do get a second opinion or a third opinion. my other points that I like to remind people about with second opinions is that you don't, a lot of times people think they just apply to diagnosis, but for example, something a lot of people don't know is that you can get a second opinion for a CT scan or an MRI, you know, any sort of imaging test. You can get second opinions on those too, which I think that kind of opens up a new option for patients as well. And then the last thing I always say is when you do get a second opinion, because I think people always should when stakes are high, don't go with a referral from provider number one. You know, seek somebody out independently, and not because someone's going to refer you to a provider that will agree with them, but just sort of the bias that tends to result from that. It's just really good to be totally objective and independent when you get your next piece of information.
That's great. That's a great tip. Thwarting error in the hospital. Do you have any tips for that?
Sorry, I didn't hear the first word.
Thwarting error, like avoiding error in the hospital.
Error in the hospital. Mm-hmm. Well, that's a big topic because our rate of medical error, especially in U.S. hospitals, is just astronomical. I mean, to me, it's really a public health crisis. It's something that we, you know, we're facing today. And so in terms of much of this book talks about how to kind of fend off error in the hospital, whether it's something like every time somebody comes into your room, making sure they wash their hands. And it sounds sort of militant and uptight, but I mean, the way, like, it is unsafe to enter a U.S. hospital today with all that, you know, it puts you at risk for. And so you kind of do need to just step up and be aggressive. And so I tell patients, just, you do not let anybody come in your room without washing their hands. And then when it comes to medication error, which is another big one that nurses are, you know, it's constantly coming up in education and training because medication error is so widespread. And so I just tell patients, if you're in the hospital, anytime you put something into your body, or someone's going to put something into your body through an IV or through your mouth, you need to ask what it is, and you need to know what it's for. And that kind of requires patients to be a little more involved. And certainly if you're not in a place you can be, to have somebody there to be, you know, your advocate that can monitor that for you. And I think just the reality is that it requires that when you're in the hospital and your health is compromised in some way.
So bringing someone to be your advocate could be really helpful.
Yeah. I always recommend that if you're in the hospital, even if it's for surgery. And I even tell people to bring an advocate to outpatient appointments too. It just helps to have another set of eyes, another mind, another person. It's always good, I think, if you're comfortable with it.
And you could discuss what the doctor said. Sometimes you could be in shock and you may not hear all the information. So having an advocate could be really helpful. I'm just going to share two things, and then I have a few more questions for you. So one time I was in the hospital. Now, I've had many positive experiences, but one time I was in the hospital, the staff was very overworked. A few people didn't show. The weather wasn't good. And so someone came in to take my temperature and the other patient's temperature in the room and forgot to change the thermometer cover. So they put the thermometer in the other patient's mouth and then into my mouth. I noticed it, but it was too, like, as they were putting it in my mouth, I was about to say, and they already got in my mouth. And it taught me to really watch. And that's what you're saying. Ask people to wash their hands, be aware, because sometimes error does happen. I think part of it is that everyone's so overworked in the hospital. So, and tired also, there is human error. So I always try to be aware whenever possible, and that's where someone being with you could help also. The other thing is, and I don't share this story a lot, but one time I was having a biopsy, and the doctor doing it looked like white as a ghost, and his hand was shaking. And before he did the biopsy, I said, look, how many times have you done this before? And he didn't answer. And then I said again, how many times? Because I'm laying there and there's this huge needle about to go into me. So usually a lot of times I don't speak up. I'm too nervous. But in that situation, I was scared. And it turned out he hadn't done it before. And I know there's always a first, but I didn't want to be the first. So I actually stopped and asked for someone more experienced to do it. And in that case, I'm glad I did, even though it was hard and I felt like a jerk doing it in a way. But I just thought my gut, a lot of times you go with your gut too, I think, of, what to say and do, especially when you're the patient lying there. But I guess awareness is key too, right? So,
Yeah. And I just tell people to remember, like, at the end of the day, when you're a patient, your responsibility is solely to yourself in those situations. So, and there's a way to, speak up that doesn't have to be on the defense or aggressive, but just to know that, like, you're your protector, like, you're your person in that setting. And so you got to just, like, do what feels comfortable.
right,
That's fair.
right. That's so important. Helping family members, parents, and friends. Getting information, where to find caregiver resources, caring for children, caring for elderly parents. What would you say about any of those?
Well, I think they're all kind of addressed in separate sections in here because it's different. If you are helping your kid get their first pediatrician, that's like a totally different thing than if you're helping, you're sort of navigating healthcare for an aging parent. So they're all a bit different, but I think that, again, it just speaks to this importance of having a healthcare advocate, especially as people age and, things get more complicated, and you really do need an advocate. And so I think that the information in here can be as powerful for somebody who's serving that role as it can be for the patient themselves. And so, yeah, I don't know if you have any specific questions, like you want to go into any of the different.
Well, care for the caregiver. What do you think caregivers could do to best serve the patient and also best take care of themselves? Because the caregiving role could be so draining. So it's important that, look, I know for me, I was diagnosed at a very young age and my mom wanted to do everything for me because she was so worried. But in doing everything for me, she burned herself out, and it wasn't enabling me to still do what I could do for myself. So I became the patient in need instead of the patient empowered, sort of, out of her love. But she neglected herself and overcared for me. So I think there's a fine line in caregiving. It's really imperative that caregivers take care of themselves. And I think what I've learned is allowing patients to do what they can do and then being there for the things they can't do, so that the patient also feels like they still have abilities rather than being completely dependent.
Mm-hmm. Yeah, and I think it goes back to what you said about sometimes if you're receiving bad news, maybe like this could be an example where you're sort of in fight or flight, and it's like the worst time to attend to information you're receiving and process it. And so in those circumstances, that is where somebody, having somebody there to kind of absorb things with you and maybe take them in. And that doesn't need to be, a situation necessarily where you're receiving bad news, but when you're, there's a lot going on and you're thinking about several things as the patient, for that role to be less kind of micromanaging and more just another set of eyes, another person in the room with you. I think that's like a productive area to channel an advocate's work into, and to just know that, when you receive news like that, when you're with a loved one, neuroscience research will show that your stress level is just decreased when you're with a loved one in a context like that, where you're stressed and you're in a stressful situation. So I think generally kind of knowing that it can fall into that category where just somebody being there can be really powerful. And then in terms of caregiver strain, that's an ongoing thing. As a nurse, I see it a lot. When patients come in frequently, I can even start to see it when a caregiver is, wearing out. And so the book, I think specifically in here, with the resource that I use is I'm trying to think of the one that's in here, but there's actually, it will send you to a source where you can evaluate caregiver strain, where somebody can kind of do it to themselves to see if they're, if they've sort of like reached the maximum with that. And I know it's not always helpful to use an online tool for something like that, but I do think it's important, because I think caregivers are expected to just sort of like hold it together all the time because they're not the one with the illness, but you can't, we're human, you can't expect that of anyone. And there are so many resources to help caregivers also. So that's why I kind of direct people into those directions, because there's a lot of support.
Can you also, do you know of any national organizations that you found helpful for caregiving, or examples of services that might be out there that they could look for?
Yeah, I list a lot in the book, but I think the best, I just want to find in here, because the one,
I know there's one in our area called Caregiver Volunteers, where they send volunteers to caregivers' homes to relieve them, and they stay with the patient. So the caregiver could go shopping or get their hair done or whatever they haven't done to neglect, for themselves. And that's one that I love. But yeah.
That's great. I think, and I'll keep looking as we're talking here, but the ones that provide, there are many that provide respite care. And so that is, I think in looking for respite care is like a great way to go. And so, yeah, I'm sorry. I'm
going to refer people to your book. That's another reason to buy the book, because of the resources in there.
Yeah.
So
resources. So I think, yeah, that's great. But I know it will come to me when we're like on to the next topic.
Okay. 2 last questions. Challenging bias, discrimination. Do you have anything to say about that?
Yeah, so much to say. I think that could be like a whole separate conversation, but a point that was really important to me in writing this was making patients aware of some of these inequities that pervade medicine right now, and kind of knowing that oftentimes as a patient you are a minority in some way, whether it is because of your sex, your background, or your race. And there are many, many care disparities that people are up against when they come into the medical system, that we where we see that we're still failing patients in terms of just implicit bias and systemic oppression. And so I try to make patients aware of them, to try and recognize and name when you might be on the receiving end of a care disparity. And also, I just think it's important for people to know, because healthcare is a lever to address social justice. And a lot of these issues are really demand, I think, more patient input now than we've given the space for. So, and it especially, I think, has to do, a big one that comes up a lot is pain, because, as a woman, it's more difficult to have your pain taken seriously. Pain is dismissed as sort of just a natural part of the aging process, when much pain as you age is not that. It's indicative of something else. There are care disparities in how pain is handled based on one's race that are, real problems facing patients. So I think, and being empowered with that knowledge is important. So the book brings up a lot of research to just make patients aware that it's a reality, not to fearmonger, but to know that these are real things you are up against when you enter the system.
That's such an important thing to note. That's such an important topic.
Mm-hmm.
So thank you for that. Dealing with insurance companies, what would you want people to know?
Well, it's never fun to call an insurance company. It's like the last thing anybody ever wants to do. But kind of, I talk through here, just like dangle a carrot in front of yourself if you have to. Like, tonight I'm going to, go over these bills. I'm going to call my insurance company, and then like get out a nice bottle of wine and like do something for yourself after, because it's never pleasant. And so often you're waiting and you have to explain something you've explained 15 times. And it's just a very unpleasant endeavor, but I think it's so essential because most medical bills will have some kind of error in them. And if you're not looking through them to catch them, there's nobody else looking for them. And so kind of understanding how to look through a medical bill and be sure that things are kosher is like a really important skill for patients to have. And the other thing about just managing insurance, I talk about in here a resource called the Healthcare Blue Book, but I think this was new knowledge for me and for a lot of patients, that there's a blue book for different healthcare procedures. And so I talk through these 3 steps in the book of how anytime you're going to get a procedure, you can go through these things, which involve getting a code for a procedure and then going to your insurance company with that code and determining then using this resource to determine what's kind of a fair price for, general price for the thing, whether it's a scan or an operation. It runs the gamut. But what often is so interesting is that you can have an astronomically higher bill just based on where the procedure would take place, for instance. And so something as simple as going back to your provider and saying, I can't have it at this facility. I need to have this scan done elsewhere. These are things that can save patients a lot of money. And it's just like a little bit of work on the front end, but that's so worth it. So just like get yourself used to making these calls and being assertive, and then like treat yourself to something really nice afterwards is what I would say.
You know what? I love that dangle a carrot thing.
Yeah.
And I'll say something totally unrelated, but I go for blood work monthly for the transplant. And every time I'm nervous to get the results or whatever, and I try not to procrastinate and I try to get it done. So on my way home from the hospital where I have it drawn, I always pass a Panera. And I love Panera's Asiago cheese bagels. But I don't eat them usually because I'm forever watching my weight. So every time I have blood work done, I stop at Panera and get a toasted Asiago cheese bagel with butter. Yeah. And I enjoy it. And that is my treat. And now I don't associate blood work with anything except an Asiago cheese bagel. So sometimes having that carrot is
you're a woman. It's good. I walk through the same exact thing. You need to it is true, because then you're going to associate it with something positive. So it's a very good idea.
And you'll get it done. The other thing I just want to say, this is unrelated to, but since patients are watching, as I get older, I get more forgetful and I question myself. And I do find that putting out your medicine for the day ahead in a medicine container is helpful, because then if you question, did I take it? Did I not take it? If you took it or not, if it's empty. So I'm finding that that's helpful and everything. Okay. Pretty much last question, understanding pharmacy options. Anything you want to say about that?
In terms of just like the best pharmacy to go to when you're getting
there's so many different pharmacies, and then talking to your pharmacist and choosing the right pharmacy, and anything with insurance regarding pharmacies.
Yeah. Okay.
Any tips with that?
So different pharmacies, like that's sort of outside of my wheelhouse, but when it comes to drugs, I think really important things for patients to know always are that every medication has 2 names. And I think it's really important to know both, because when you're dealing with a prescription, there's often, a generic option that may be more economical. So kind of knowing the generic name of the drug you're dealing with is always important. Talking to your pharmacist about options, because often, provider might prescribe a trade name drug just because it's kind of the newest thing, or maybe because they have a relationship with the drug company, and and that's real, and that happens a lot. So I think going to a pharmacist and really assessing different options is always good. And then I'm trying to think, the other thing is that pharmacists are just like encyclopedias of knowledge about medications. As providers use them all the time, nurses use them all the time. It's like if you have some random question about a side effect or an interaction, like they're really the people to go to. So I say to I joke about in this book, but I would always get kind of irritated, like signing that box, like, decline to talk to the pharmacist, because it just, I always would feel bad about it. And, now I think like, oh, it's like really valuable time to ask, because you always kind of later like, oh, I wonder if, I have a glass of wine, if it's going to interact with this med, or if like I'm getting this migraine and it has to do with X, Y, and Z with this medication regimen. And like, those are things you can ask a retail pharmacist, and also in the hospital, you can always ask to see a pharmacist as well. They're kind of like the gatekeepers of all medications that go throughout a hospital system. So I think they're like invaluable sources of information. I think so
too. Before we end, you're a nurse. Why do you think nurses play such an important role, and how do you define that role?
Well, I say so often that nurses have this like real privilege, which is just this kind of immediate trust that patients will place in us. And I kind of semi-joke about this, but nurses are always in Gallup polls every year. They're voted the most trusted professional. There was like one year they lost to firefighters, but nurses are just seen as this sort of bastion of trust in a system that I think today invites a lot of mistrust from patients. And so, being on the receiving end of that, I think you're like aware that it's really a privilege. And then another result is that you just get so many stories, and you get time with the patient, and you get to kind of see all of these ways that medicine really might not acknowledge, like the human condition, and these things that are really important to care that are not acknowledged in the way it's delivered. And so I just tell people, when it comes to nursing, to kind of look to the nurses around you with this like spirit of collaboration, because nurses are trained really at the core of the training of a nurse is how to advocate for a patient within the medical model. And so they're your fiercest advocate in your endeavors in the healthcare system, I think.
Thank you. And thank you for being an incredible nurse and for writing this book. Can you hold it up one more time so people know what to look for? So this is available on Amazon, Barnes & Noble, and pretty much wherever books are sold. How to Be a Patient, The Essential Guide to Navigating the World of Modern Medicine by Sana Goldberg. Sana, any final thought that you'd like people to know or take away?
I think that we have covered so much of what's in here, but I think just to feel empowered. I hope, if I had one hope with this book, it's that people feel more empowered when they walk into an appointment. So I think that would be it. But thank you so much for having me. And
thank you.
Well,
and thanks to everyone watching and everyone who joined. Thank you, and look for the book. It's incredible and very valuable. So thank you very much, Sana.